Aladdin Creations.
Hello guys, welcome to another video from Aladdin Creations. My name is Kavindu. I have already shared with you many of need to know things about anemia. We know that anemia can be classified into three according to their cell morphology. Out of these three, we have already discussed about microcytic and normocytic anemias. Today's video will be about vitamin deficiency anemia, which is a type of macrocytic anemia.
However, it is important to remember at this point that vitamin deficiency is not the only cause for macrocytic anemia. Other causes include liver disease, alcoholism, hypothyroidism, COAD, etc. Pathophysiology. There are two vitamins which in their deficient state can cause anemia. They are vitamin B12 and folate. In order to explain how folate and vitamin B12 deficiency can cause anemia, we need to understand how they contribute to red blood cell production. Both these vitamins are essential in the process of mitosis through which red blood cells are produced in the bone marrow. Before any cell division, replication of DNA needs to take place. For DNA replication, ample amounts of free deoxyribonucleotides are necessary. Folate, or rather methylene tetrahydrofolate, which is an active form of folate, acts as a coenzyme in the process of producing DTMP, which is one of the essential nucleotides for DNA synthesis. B12 is required to synthesize more methylene tetrahydrofolate from one of its other forms, methyl tetrahydrofolate. By the mechanisms discussed just now, both folate and vitamin B12 plays a part in red blood cell production. Hence, a deficiency in any of these will reduce the efficiency of erythropoiesis, resulting in anemia. Causes. A vitamin deficiency may occur due to several reasons. Nutritional deficiency is a major cause for both folate and vitamin B12 deficiency. Vitamin B12 in food binds to a glycoprotein called intrinsic factor, which is secreted by the stomach. This facilitates its absorption, which mainly occurs in the ileum. Hence, gastric causes like pernicious anemia, which is a term used to describe intrinsic factor deficiency and gastrectomy, as well as ileal causes like ileal resections, blood loops, and presence of fish tapeworms in the ileum may cause vitamin B12 deficiency. Folate, on the other hand, is absorbed in the jejunum mainly. Hence, inflammatory conditions in the jejunum, such as celiac disease, can affect folate absorption. Folate deficiency may also occur in stages of high demand, such as pregnancy and myeloproliferative disease. Clinical features. Patients with vitamin deficiency anemia will also present with the common anemic symptoms such as pallor, fatigue, shortness of breath, etc. They will also have glossitis and angular stomatitis, which will be evident upon examination. Vitamin B12 deficiency but not folate deficiency will cause peripheral neuropathy and a condition called SACD, subacute combined degeneration of the spinal cord. Laboratory investigations. A full blood count will show a decrease in the hemoglobin level and hematocrit. The characteristic feature will be the increase in MCV. It will be more than 96 flights and most of the time even higher than 125 femtoliters. As suggested by the FBC, the blood picture will also show macrocytes. There will also be a reduction in neutrophil and platelet numbers during effective production. The bone marrow will be hypercellular and have large erythroblasts. Hence, these kinds of macrocytic anemias are also called megaloblastic anemias. Several specific tests are available to establish the exact cause. These include serum B12 assay and Schilling test for B12 deficiency and red cell folate assay for folate deficiency. Treatment. Vitamin deficiency anemias are treated by supplementation of the deficient vitamin. Folic acid is given orally and hydroxycobalamin vitamin B12 as an intramuscular injection according to the need. However, we should start both vitamins if we are sure of the cause, as giving folate only may worsen the neuropathy in B12 deficiency.